This Cincy Lifestyle Health segment, sponsored by Mercy Health.
When you've suffered a heart attack or are dealing with an ongoing heart condition, it can be easy to lose sight of the life you love. Mercy Health has dedicated cardiovascular specialists that are there to help you navigate and maintain a heart-healthy lifestyle.
My name's Joe Miles. I'm an invasive cardiologist here at the Mercy Heart Institute at our Mercy Anderson Hospital location. The heart's job is to pump blood to the body, to carry oxygen and nutrients to the tissues and organs of the body. And in heart failure syndrome, the heart is failing to keep up with demand, if you will. It is no longer capable of carrying those vital things to the tissues and organs of the body without assistance. You mentioned heart failure to patients and it worries them, right? It is not that the heart has stopped working, but it is that it is not working to its fullest potential any longer. So the hallmarks of congestive heart failure are rapid weight gain, lower extremity, especially swelling or edema we call that, increased abdominal fullness and fatigue, as well as inability to lie flat. So a difficulty breathing or a nighttime cough when trying to lay flat. Oftentimes I'll ask my patients, how many pillows are you sleeping on, or are you going into the living room to sleep in the recliner? Congestive heart failure is a clinical diagnosis, so based on those symptoms that we just mentioned and signs by exam. So when your doctor assesses you here at the Mercy Heart Institute, they'll be examining your body, asking you questions, regarding these symptoms or hallmark findings of congestive heart failure. But on exam in particular, we're looking for swelling. We're looking for fluid in the lungs and signs by exam of that. So based on exam and history, if we suspect congestive heart failure, you can expect to have pictures taken of your heart. So that's an initial step. It's called an echocardiogram. That's an ultrasound of your heart muscle. It takes a look at the heart strength, at the structure of the heart, so how thick are the walls of the heart, what do the valves of the heart look like, is there any pathology there, any problem with the heart valves. It can tell you an awful lot of information about why this is happening with a patient and then lead to further downstream testing as appropriate. There's a lot of changes one needs to make when they're diagnosed with congestive heart failure. It is really a whole lifestyle change. So what are we eating? What are we drinking? How are we moving our body? Those are three important questions. Here at Mercy, Anderson and at the Mercy Heart Institute, we have congestive heart failure educators. We have an excellent cardiac nursing team that's well trained in educating our patients on the unit. So we'll be educating you on the diet changes to make. Low salt diet, fluid restriction, and generally trying to implement that Mediterranean diet, which incorporates the DASH diet, low salt aspect, but a heart healthy diet in combination with that. So that's the diet aspect. As far as lifestyle changes, of course, taking medications. Medications are a big part of this. And then how do we move our body, right? So we know that a sedentary lifestyle is harmful. And so we educate a patient that the American Heart Association recommends about 150 minutes a week baseline of moderate intensity exercise. So when I counsel my patients on what that means, I say you got to glisten, you got to break a sweat, you got to get huffy chuffy. My nurse will tell you that. We say it over and over again, but these are the things that make a difference in your longevity. For more information or to schedule an appointment, go to mercy.com/Cincinnati.